Hi, I'm Dr. Ottavio Nepa. I'm a chiropractor. I want to talk to you today about carpal tunnel syndrome. Do you have symptoms of pain in your hands, or numbness and tingling, or a burning sensation? Through the years in my office, I've had many people come in with these problems. A lot of them had already been to surgery and still had the symptoms. So what I'd like to help you do, I'd like to give you some tips on things that you might do that are less invasive before you go ahead and get surgery, because there are some options. First off, there's two types of carpal tunnel syndrome. There's true carpal tunnel syndrome that actually occurs in the wrist. The carpal tunnel is made up of a double row of bones on the bottom and a ligament over the top. Passing in through that tunnel are tendons and blood vessels. What could happen is the tunnel could collapse and compress the nerves and tendons, causing all those symptoms I mentioned before, or the contents can swell. Well, what causes that to happen? It can either be repetitive movements, such as working on the keyboard, which I'm sure you've all heard about already, or it can be high force moves. Let's say the difference between amplitude and repetition is somebody might be working the keyboard and do thousands of keyboard strokes in a day, or you might be a carpenter who's constantly sawing or swinging a hammer. The repetition's a lot less, but the amplitude, the force is much greater, and it adds up to the same thing. Here's the problem though. This is what makes carpal tunnel syndrome, or carpal tunnel-like syndrome, very difficult and often misdiagnosed. And this is what I'm trying to help lead you through so that you don't make this mistake. There's nothing wrong with surgery if you need it. There is, however, something wrong with surgery that's unnecessary and doesn't fix the problem. Okay, so I want to help try and steer you through that. The other thing that can cause those same symptoms of pain, numbness, tingling, burning are either compression of the nerves from bones, or vertebra would be more accurate, in your neck, where the nerve comes out of your neck and travels down into your arm. That can cause the same symptoms as the nerves being compressed right in your wrist. The other thing, and the most often overlooked cause for these, is when you have compression of the nerves by muscles that are nowhere near the wrist or not in the wrist. Okay? These muscles can be anywhere from the side of the neck, under the armpit, or the axilla as we would call it, or anywhere in the forearm. As a matter of fact, the number one place that actually causes probably 80% of all carpal tunnel-like symptoms is a muscle right in your forearm. It's called the pronator teres. Okay? It's not important you know the name, but it's important that you know the muscle is shaped like a V, and the median nerve passes right through it. Well, in most everything we do, we flex that muscle, and very, very frequently, patients will have a very tight pronator teres muscle that then clamps down on the median nerve. And the median nerve is the muscle that's involved in causing carpal tunnel pain. Okay? So, you want to find a doctor that is skilled in assessing adhesions. To be more, I should explain what an adhesion is. An adhesion is when the muscles or the fascia stick to the nerve. Well, what is fascia? Fascia is like, imagine it like a stocking that holds together bundles of muscles, okay? Groups of muscles. So the fascia is on the outside, the muscles are on the inside, and then the nerves weave their way through all those muscles. Well, the nerve is supposed to slip and slide in between those muscles, pressure-free, without pressure, okay? Pressure equals pain. But what can happen is the muscles can start, or the fascia can start adhering, sticking to the nerve. So when you move, the nerves get clung to or adhere to, and you get those symptoms. So you want to find a doctor that's good at assessing myofascial problems and knows how to relieve them. A good place to do that is find a doctor. Typically you'll find a lot of chiropractors, not a lot, but there are several chiropractors, and you can go to the website for activerelease.com, Active Release, and find a provider in your area. Okay? Those providers are typically very, very good at assessing adhesions, finding other causes of the problem, and you can actually clear up the carpal tunnel syndrome very easily in many cases without surgery. I hope that helps. If you have any questions and you'd like to email me, you can go to my website, which is endyourpain.net. I hope that helps. Bye-bye now.